This is the Emergency Medical Minute, sponsored by Health One.
Okay, we're going to do a little bit of a medical minute on strep throat. So, very exciting topic, as all of you know, and very common topic. We have a lot of people come in with sore throat to the emergency department. Around how much of the strep throat that we actually treat in the States is actually strep throat? They had a study in, I think it was like 13 or 14, that showed that only 10% of people who get antibiotics for sore throat actually have strep throat. Which is, to me, kind of crazy because if you swab all of us, it's around 20% are just carriers of strep. So, a lot of our things where we're calling people strep throat are actually just carriers. So the question of this article is, do you actually need to give antibiotics for strep throat? What do you think the answer is? For the most part, no. Strep throat's pretty self-limited. It's going to get better on its own. And antibiotics, in some of the studies, just show that they decrease how long you feel like crap from a few days to maybe 12 to 16 hours less. So what's better than antibiotics in terms of time to resolution? It's Decadron, steroids. Steroids actually make people feel better pretty much a day before, 24 hours before after you treat them with that. So people treat with strep saying, well, maybe it will prevent complications such as, a peritonsilar abscess or more severe infection. The other things associated with strep are otitis media and also sinusitis because all that crap drains to the back of your oropharynx. So if you have big tonsils, that possibly creates those secondary infections. And the evidence for that is somewhat questionable. It does prevent it, but you have to treat hundreds of people to prevent one case. And then around 10% of people you do treat with antibiotics get what? Not anaphylaxis. Diarrhea, right? So diarrhea, yeast infections, other complications things. So are you actually creating more infections or creating less infections when you treat people with antibiotics for strep? There's other things that happen with strep which are kind of interesting. Does anyone know what pandas is? No, it's more than just a cute furry animal in Asia. Pandas is like pediatric associated strep psychosis, basically, where you get this really interesting autoimmune response in kids and they kind of go crazy for a little while, all because of secondary strep things. Other things that happen with strep are like post-streptococcal glomerulonephritis. Have you guys heard of this? Yep. So basically strep and afterwards your immune response can hurt your kidneys. That's actually not decreased by antibiotics. And the most famous strep-related complication is rheumatic fever. Exactly, rheumatic fever. And back in the 50s, we used to think that a lot of people, we knew that a lot of people got rheumatic fever from having previous streptococcal infections. And there was one study done in the 50s on a military base that says if you treat people with antibiotics early, you cut that in half. That is no longer the case. That specific serotype of strep throat really isn't prevalent in the United States anymore. So you don't really prevent a lot of rheumatic fever. We don't really see a lot of rheumatic fever from streptococcal infections. So antibiotics, pretty much optional in strep throat. I think we can have a discussion with patients just the same way that we do when we have discussions with patients about otitis media, which also doesn't really need antibiotics. And hopefully we can decrease our unnecessary antibiotic use. Okay, thank you.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.